This paper is a extremely short version of the argument that I make in my forthcoming book, Deluxe, Jim Crow, the South, and National Health Policy, coming out with University of Georgia Press, hopefully later this year. We need to introduce a new term into the lexicon of civil rights history, Deluxe, Jim Crow. How can Jim Crow segregation possibly be deluxe? In the iconography of the civil rights movement, Jim Crow segregation is anything but deluxe. The definitive black and white photographs that you see in museums, documentaries, popular books and film, Jim Crow is represented as peeling paint, dilapidated school desks, signs with white and colors that invariably denote the inferiority of accommodations and services provided under the guise of segregation. So what is Deluxe Jim Crow and why do we need it? I was thinking of some synonyms to hopefully kind of get you oriented to what Deluxe Jim Crow is, and I would use pragmatic, opportunistic, Janus-based, transitional, incremental, politically savvy. Deluxe Jim Crow is about the politics of the possible in a very racially polarized era, and it focused federal aid toward regional uplift of the South, which, by downplaying race, diffused white fears of federal interference. Brown versus Board of Education is hailed as the most important Supreme Court decision of the 20th century, and education has overwhelmingly colored our understanding of the tactics, priorities, and achievements of the civil rights movement. Richard Kluger begins his magisterial history of Brown with the observation that schools were, quote, the largest, costliest, and most important public enterprise in most American municipalities, unquote. But what about the role of government hospitals or public health programs? The narrative of Brown does not explain, and in fact obscures, the mercurial evolution of segregation during the 2 decades before 1954. By the 50s, it had been considerably weakened by a number of interrelated developments. Most of those came from health policy, not education. These developments ideally positioned the direct action civil rights movement to deliver a rapid and devastating series of blows to legalize segregation and disfranchisement. The term Deluxe Jim Crow was coined in 1952 by Montague Cobb, a leader of the medical civil rights movement who taught anatomy at Howard University. Deluxe Jim Crow described the proliferation of thousands of new hospital beds for blacks in segregated wards, floors, and wings across the South. Cobb's epithet expressed outrage that any form of segregation, no matter how purportedly beneficial, could ever be considered truly equal. Cobb followed in the footsteps of NAACP chair Louis T. Wright, who was a Harvard-trained surgeon and very prominent in that field as well, and other early integrationists who feared that this allegedly kinder, gentler form of segregation might become impossible to eradicate, like an antibiotic-resistant strain of tuberculosis. Wright, Cobb, and their allies fought ferociously against the expansion of segregated care, even if it meant sacrificing public and philanthropic aid to black health in the short term. Civil rights historians have adopted a similar view that accepting anything less than full equality unnecessarily prolonged the inevitable death of Jim Crow. Blacks who either did not actively support integration or pursued pragmatic alternatives are judged self-serving Uncle Toms. And that charge that I think has been especially leveled at black physicians who've had a lot of professional issues at stake as well as civil rights issues, or those two were very closely linked. Whites with those views are deemed paternalistic gradualists without genuine interest in black welfare, whose chief aim was to obstruct substantive progressive change and shore up segregation. What did Deluxe Jim Crow look like? The advent of biracial general hospitals transformed the nature of segregation from separate buildings, or often nothing at all for either race, to partitioning within the same structure. This had several practical and rhetorical advantages. Southern, state, and local governments could simultaneously comply with segregation laws and respond to growing pressure for the inclusion of blacks in public facilities. They also achieve cost savings and operational efficiency by using the same staff, auxiliary services, and medical technology as white patients. But the blood supply and medical instruments were kept separate and labeled for colored and white patients. So that's one aspect of this. The difference between regular versus deluxe Jim Crow, actually I want to go back. Well, the slide I just showed of Whites Ferry, Louisiana, the tuberculosis sanatorium. Another adjective I could use for deluxe Jim Crow is symmetrical, mirror image. That building, there's a central facility in the middle where most of the medical care took place, and then there are exactly equal black and white wings on either side of the building. And, that's okay, I'm done. And by the way, there's information on the slides that's not necessarily in the talks about the slides meant to supplement what I'm saying. So the difference between regular and deluxe Jim Crow is most dramatically illustrated in the transformation of Charity Hospital in New Orleans. In 1935, Carlton Beals wrote an expose of Huey Long's Louisiana for the Nation with the sardonic title, Louisiana's Black Utopia. He described the disgrace to civilization that he found in Charity Hospital's Jim Crow ward. Patients sleep 3 in a bed in chairs on the floor. The screens are thick with dust. The place is filthy. Ants crawl on the beds. The obstetrics ward would disgrace a Quechua Indian village. Shortly before his death, however, Huey boasted of the fine attention given Negroes in public clinics and hospitals. Gotta keep them healthy, that's fair and it's good sense. I said to the whites, you wouldn't want a colored woman watching over your children if she had diarrhea, would you? Now, I might disagree with Carlton Beals in how much he takes Huey Long at face value. And that's part of the difficulty of deluxe Jim Crow, is you're never quite sure what people are saying for what reason. I would say Huey Long did a lot of playing to white fears about race in order to basically get their approval for changes that did benefit blacks. So that's kind of an aside. Now, in the decade after Long's death, in 1935, this is not, that's not what I want. Help. Louisiana constructed 4 new charity hospitals around the state and erected a massive new main building for New Orleans' charity hospital. It went too far. Wait, no, it's okay, never mind. The $12 million structure was the single largest federal hospital project of the era, the most deluxe Jim Crow hospital of all. The expansion made Charity Hospital the second largest hospital in the United States and the largest state health facility in the world for the treatment of acute and contagious diseases. Grady Hospital, Atlanta, also built a huge new facility in the early 50s. These were the really huge deluxe Jim Crow hospitals, but facilities like this were built around the South in all the southern states and border states. The 20-story, 2,700-bed main hospital building was, again, divided symmetrically with wards for blacks on the east side and whites on the west. And when they desegregated, they converted the colored and white signs to east and west. Each ward was a complete unit with treatment rooms and doctor's offices, and a pneumatic tube system connected each of the 50 operating rooms to the pathology laboratory, a 14-story school of nursing, training laboratories, and classrooms for medical students from Tulane and Louisiana State University, an ambulance garage, and several warehouses and workshops were also part of the multi-building complex. The teaching hospitals for Tulane and LSU medical schools occupied the 2 wings on either side, and they treated a lot of indigent black patients who were from 2/3 to 3/4 of the admissions at Charity.